Hi, Sarah here from the Centre for Mental Health, and I hope all is well this week. Today we're going to talk about the Mental Health Act review, and the reason why I thought it might be a good idea to talk about that is because the report will be due out in the next couple of months. But we have been running a series of blogs from people who have lived experience, from people who have used the Act to make somebody safe. And we have found some quite kind of moving and powerful testimony about how the Act might be improved. I've been very lucky. I have been invited to take part in the review of the Act and have worked closely with Sir Simon Wesley and others about what the priorities needed to be. What we do know, and we're certain, the Mental Health Act review alone will not attend to all of the complexities around the Mental Health Act and how it's applied. The reality is for the Mental Health Act to be used to its full advantage, the conditions in which we need to consider are the funding for services. Are community services robust enough? Do we have enough things in place to make sure that where possible people can avoid a section under the Mental Health Act? That we can foresee crisis in time to make sure people can stay in control? It's been really powerful to listen to people who have had their liberty deprived through the Mental Health Act, and the implications of that in terms of recovery, in terms of swift recovery, and often experiences of trauma and despair are very much the things that are left behind because of that experience. We know that isn't good enough. The foundations of the review were based on kind of many worries, I think, that the government had about the way in which the Mental Health Act is being applied. One of those things was the number of black people in hospital and in the criminal justice pathway as a result of section. We, as part of the review, have taken this absolutely as one of the most important concerns that needed to be addressed. I don't know yet whether we have addressed that well enough. I hope we have. We have people on the advisory group who have certainly held a mirror up to all of the people round the table. And sometimes it's been uncomfortable. It's been uncomfortable to hear about when the review or when the Act hasn't really attended to those particular issues. We hope that we will be able to kind of develop some robust recommendations for change, and we want the government to listen. We have some really good evidence about what works in the community. We have some really good evidence about what the workforce needs to maintain a values-led approach at the most difficult times. What we need is the government and all of the bodies responsible to take note of that evidence, to put it into practice. And we certainly know that it's not easy and many things need to be considered. But we need to consider them, we need to take them seriously, because these issues that people who have lived experience have been raising with us as part of the review have been known for a very long time. It's not new news. So the review, I think, has a great opportunity. And I know that some of the recommendations might seem kind of radical to some and maybe not radical enough to others. We wait and see. We at the Centre are still very keen to know what you think and what is still important for you about the Mental Health Act review. It's still kind of timely. It's still time enough for that feedback to be given to those who can take it to the table. The Mental Health Act review has been challenging, and I look forward to seeing the final report, and I look forward to hearing about what people think in terms of the recommendations. But I think the main thing that I've been struck by is that the Commission or the Review Advisory Group has been absolutely committed to trying to find solutions to the biggest problems. And it's been done with compassion and thought. We've not always agreed, but certainly there have been times when there has been breakthrough moments of clarity about the direction of travel. We certainly know that the numbers of people who are restrained in hospitals or restrained on the street because of section needs to change. It needs to reduce quite dramatically. And certainly for women, restraint in particular is an absolutely traumatising experience. All of these things have been absolutely at the top of the agenda. So let us know what you think. The Mental Health Act is an important piece of legislation. It really is. It comes into play when people are at their most vulnerable. So let us know what you think. We want to hear it.